So very recently, I took a horrible exam called neurology, which not even the devil himself can fathom writing, and that involved memorizing a literal fuck ton of medications. Now with this newfound knowledge of medications, I really wanted to put it into use. So I really wanted to find out which one's the best out of them all. I really wanted to have them all square off against each other in an arena to find out which one's the winner, but that is not possible. So instead, I decided to rank them the boring way. I needed a system that will take in all sorts of variables to be a very comprehensive review of these medications to rank them accordingly. So I decided to pick the tier list. The tier list, as we all know, is the most authentic way to rank things. It's been used to settle multiple law cases, it's been used to settle debates, and it's even been used by Jesus Christ himself to rank cereals, fruits, and other sorts of foods. Therefore, I decided to use it as well. I'll be using 3 sets of criteria to rank these medications. These criteria have been approved by all sorts of organizations, entities, research committees as the most objective way to rank medications. So the first criteria I'll be using is what the fuck they do. The second criteria I'll be using is what the fuck they do to you. And the third criteria I'll be using is how cool they sound. Let's get started. Over here I have a bunch of medications I stole off Google. So let's start off. Our first medication over here is Prozac, also known as fluoxetine. Fluoxetine is an SSRI. This drug is actually very useful. It's used in the treatment of depression, OCD, PTSD, anxiety, etc. As far as the side effect profile is concerned, it's actually pretty mild, with the exception of some weight gain, some sexual dysfunction, maybe a severe reaction where it interacts with other drugs that may cause it to enter a syndrome known as serotonin syndrome, which is an emergency that needs to be treated. So think of a time where you have been stressed by an exam, but multiply that by about 1 million. Now, as far as its name is concerned, I think it's a very cool name. That's why I'm going to have to put this medication, because of its side effect profiles and because of its very usefulness, in the S tier. For the next drug over here, we have sumatriptan. Now, sumatriptan is an interesting drug. Sumatriptan is actually used for the treatment of headaches, specifically migraines. Sumatriptan, what it does is that it causes constriction or narrowing of blood vessels in the head. Now, for some reason, I don't know why the fuck this happens, but it eventually leads to the relief of headaches. I'm not going to question why it does it, I just know it works. As far as its side effects are concerned, basically because of this narrowing of the blood vessels, it can cause narrowing of the blood vessels of the heart, which may cause a condition known as angina, which is chest pain, and sometimes may precipitate heart attacks. Because of that, I'm going to have to rank this medication in the A tier. Next, we have a medication known as clozapine. So clozapine is an antipsychotic. Basically, it's used in the treatment of schizophrenia. Clozapine specifically has pretty nasty side effects. Number one, it causes weight gain, and it's not like the weight gain from SSRIs, it's actual weight gain. It's stupid. It causes your metabolism to absolutely go haywire. Other side effects include agranulocytosis, which basically means that your white blood cells go absolutely poof, get annihilated and destroyed, which predisposes you obviously to infections because your immunity is gone. Therefore, I'm going to have to rank clozapine as a B tier medication. Maybe even C. L-Dopa, carbidopa, levocarb, whatever the fuck you want to call it, is the medication for the treatment of Parkinson's disease. Now, unfortunately, this medication is not preventative. It delays the onset of the disease, prolongs the life of the person. As far as its side effect profile is concerned, it causes orthostatic hypotension. What this means is that if you stand up too fast, you may feel like you're about to black out. Well, basically, this is that, but on steroids. Other side effects include nausea, vomiting, and even hallucinations. Because of this pretty nasty side effect profile, I'm going to have to rank this medication, despite its usefulness, in the B category. So the next drug I have over here is propofol. Propofol is an anesthetic. It's one of my favorite drugs. Its name is super cool, so it sends you to bed. Now, as far as its side effect profiles are concerned, it's pretty mild if controlled well by the anesthesiologist. It causes your lungs to forget that they can actually work. And that's about all in propofol. So because of its cool name and its pretty mild side effect profiles and its importance in anesthesia, I'm going to have to rank it as A. So the next drug over here we have is Effexor or venlafaxine. It's a selective norepinephrine reuptake inhibitor, very similar to SSRIs. It treats very similar conditions to SSRIs, but to a lesser extent. Its side effect profile is also pretty similar because they pretty much do almost the exact same thing. No one actually knows how they work or how they treat any of the conditions they treat, but they just do. Venlafaxine is used in the treatment of depression, can be also used in the treatment of PTSD and other conditions. As far as its side effect profile are concerned, as I mentioned, it's very similar to SSRIs. It causes you to go agitated, you can go absolutely nuts. Just think about being stressed and steroids. Because of its leaching properties, I'm going to have to rank this one also as an A. Now the next drug we have over here is morphine. Everyone knows goddamn morphine. Pretty boring name. I don't actually like this drug because all it does is pain relief, but it gives you a million headaches as a result. Its side effect profiles, most concerning being the addictive potential of this drug because it's an opioid. And obviously if you're addicted to it, it may cause withdrawal symptoms if stopped suddenly. As far as other side effects are concerned, it basically causes something similar to propofol, where it causes your lungs to forget that they can actually function and also causes your mental functions to go haywire. Because of its side effect profiles and because of its horrible uses, I'm gonna have to rank it as a D. So next we have is Xanax or alprazolam. Both are very cool names, the brand name and the medication name. The medical name is actually alprazolam. It is a benzodiazepine. This drug specifically is used for insomnia and sometimes in anesthesia. Other benzodiazepines can be used for the treatment of seizures and other sorts of conditions like muscle spasticity, etc. Very similar to propofol, it can cause your lungs to forget that they can actually work and make you choke to death. It may also have an addictive potential similar to morphine, so patients can get addicted, but as far as its actual deadliness or fatalness, it's not that bad as compared to morphine. Because of its uses, I'm gonna have to rank this medication as a solid B. So the next drug I have over here is methylphenidate. Methylphenidate is the most prescribed drug for cases of ADHD and the most useful in the treatment of ADHD. As far as its side effects are concerned, so think about caffeine and basically increase that by about 2 or 3 times. So it causes palpitations, agitation, high blood pressure. So in that case, despite its usefulness in the treatment of ADHD, and because of its side effect profile and its boring name, I'm going to have to place this drug as a C. Next we have is bupropion. It's an atypical antidepressant. It has a pretty cool name. Its only use is basically depression. It may also be used in anxiety disorders, but it's mostly used in depression. As far as the side effect profile is concerned, actually pretty mild, except that in anorexic patients it may cause seizures, also causes insomnia. Now, as far as this drug is concerned, it may be preferred over SSRIs sometimes in the treatment of depression because this thing doesn't cause sexual dysfunction. But pretty much that's about all. As far as bupropion is concerned, because of its cool names, because of how it works, I'm gonna have to put it as an A. So the last drug I have over here is Xyrem or sodium oxybate. So this bad boy knocks you the fuck to sleep. It's used in the treatment of a condition known as narcolepsy. Patients will feel sleep attacks during the day and will have a tendency to fall asleep. So the idea of this medication is that we improve the sleep quality of the patient during the nighttime, so these attacks happen less during the daytime. The only side effect that is really concerning about Xyrem is its life-threatening effect. It causes your lungs to forget to work. Its name is super cool, and I'm gonna rank this in A. Actually B. Kind of deciding right now. Yeah, B, because it doesn't cover much conditions. This is a very authentic list, by the way. This list over here summarizes every medication that is given to the brain, and obviously the winner over here is SSRIs. Therefore we can just dump all these. We don't need them anymore. We just need this one. That's it. The end. Goodbye.